Good evening all. Welcome to this new session. We will try to discuss few interesting musculoskeletal spotters. So this is the first case. This was a stillborn baby. So here you can see there is a large head, even large protuberant abdomen, narrow thorax, and short upper and lower limbs. Even there is a deformed metaphysis, that is cupped metaphysis, short ribs, and even there is complete absence of the ossifications of the vertebral bodies, and even there is absence of the ossifications of the pelvic bones. This was a classical case of achondrogenesis, and there is no air in the lungs. So this was a case of stillbirth. So antenatally also these babies will be having a large head with lack of ossification of the vertebral bodies, give the classical floating head appearance, and there will be narrow thorax with large protuberant abdomen associated with polyhydramnios and hydrops. So this is a lethal skeletal dysplasia. Differentials can be achondroplasia, achondrogenesis, and even if there is complete absence of the ossifications of the skull bones, it can be acrania. So remember achondrogenesis as one of the lethal skeletal dysplasia. Thanks to Dr. Shashank for contributing this case. And next case is sacral. You can see there are multiple ill-defined lytic areas. Some are showing trabecular pattern and some are showing honeycomb-like appearance. And even here you can see there are multiple lytic areas. Some are showing sclerosis, some are showing expansion with associated well-defined margins. And this typical trabecular pattern and honeycomb pattern in the pelvic bones and multiple lesions involving both sides. This was a case of sacral hemangiomas. Normally hemangiomas are common in vertebra, but pelvic hemangiomas are nothing but sacral hemangiomas are rare. So one of the differentials can be if there is involving a single bone, and if it is involving the femur, it can be fibrous dysplasia. And this is a young female because we can see there is a intrauterine contraceptive device. And if they're elderly male, if there are multiple lytic lesions, we can suspect multiple myellar metastasis. So this is a case of multiple sacral hemangiomas, which is not that much common. Next, here also you can see there is a soft tissue density lesion which is protruding from the gluteal region. Here on the radiographs, here you can see this is the soft tissue density lesion, but on the CT you can clearly see there is a bone-like structure noted in the soft tissue density, which has a broad base and which is narrowed at the tip. So this is a classical case of pelvic digit. So pelvic digit or pelvic rib or pelvic finger or 11th finger is a rare congenital abnormality where there is development of bony tissue in the soft tissue pelvis and less commonly in the abdomen, and there can be associated one or more pseudo articulations like this. In this case we can see there may be pseudo articulation with the pelvic or pelvic bones or with the joints, and this is also considered as don't touch lesion. Thanks to Dr. Atul Deshmukh for contributing this case. Next case, you can see here there is a diffuse sclerotic there is diffuse osteoid lesion with a bony lesion with osteoid matrix noted in the calcaneum, which is replacing the wall of the calcaneum. So this was a case of calcaneal osteosarcoma. Generally the calcaneal osteosarcomas are common in long bones, but here calcaneal osteosarcoma is one of the also one of the entity we have to remember. So osteosarcoma of the foot bones is the least common, accounting for 1% of all cases, and 75% of cases arising from calcaneum or metatarsal bones. Osteosarcomas of the foot are likely to be low grade and have high reported survival rates. It can be also associated with Werner syndrome, hereditary retinoblastoma, Li-Fraumeni syndrome, or Rothman-Thompson syndrome. Osteosarcoma is the most common malignant tumor of the calcaneum, followed by Ewing sarcoma and chondrosarcoma. Sometimes even sclerotic phase of Paget's also can involve calcaneum. So these are the common differentials. Next, here you can see this is a there is broadening of the metaphysis, and there are multiple linear bands of sclerosis noted in the metaphysis, which makes the celery stack. So that's why these are called as celery stack metaphysis. Remember making the celery stack. This is the celery stack. So celery stack metaphysis refers to a plain film appearance of metaphysis, which has multiple longitudinal aligned linear bands of sclerosis, commonly seen in congenital infections like congenital rubella, congenital syphilis, or congenital CMV infections, and even in osteopathia striata. Next, here you can see this is the radiographs of the bilateral foot. You can see the there is comma shaped deformity. Typical, there is comma shaped deformity of the navicular bone. Here you can see this comma shaped deformity occurs due to collapse of the lateral portion of the navicular bone. Here this is the collapse of the lateral portion of the navicular bone, and there is abnormal medial or dorsal protrusion of the navicular bone. So whenever you see this type of comma shaped deformity of the navicular bone with sclerosis and even uh, medial or dorsal protrusion, definitely suspect Mueller-Weiss syndrome. The Mueller-Weiss syndrome is nothing but osteonecrosis of the navicular bone, and this syndrome is distinct from Kohler disease, which is nothing but osteonecrosis of the tarsal navicular bone that occurs in children. And CT may show typical sclerosis with comma shaped deformity. MRI is most sensitive in diagnosing marrow edema and early avian changes. So whenever you see comma shaped deformity of the navicular bone, definitely suspect Mueller-Weiss syndrome, which is nothing but osteonecrosis of the navicular bone. Here you can see there is a bony lesion which shows typically ground glass appearance, matrix which shows ground glass appearance. This is nothing but a fibrous dysplasia, and also you can see there is a hypodense lesion noted in the muscles, gluteal region, which is nothing but a myxoma. So whenever you see fibrous dysplasia in a single bone or multiple bones associated with intramuscular myxomas, definitely suspect Mazabraud syndrome. So Mazabraud syndrome is a rare benign disorder characterized by association of singular multiple intramuscular myxomas with monostotic or polyostotic form of fibrous dysplasia. Next, this is the last case where you can see there is a large soft tissue lesion arising from the sternum, which is showing multiple rings and dots and arc-like calcification, and also which is predominantly hyperintense on T2. So the lesion is extending from the sternum into the subcutaneous tissues and even extending into the thorax. And partly abutting the heart. So this was a case of sternal chondrosarcoma. Generally, chondrosarcoma is common in pelvic bones and flat bones, but sternal chondrosarcomas can also account for 2% of cases. So, and the classical rings and dots are like arc-like calcifications or popcorn calcifications are commonly seen. Rarely moth-eaten appearance or permeative appearance can be also seen in high-grade tumors. And T2, typically there will be very high signal intensity in T2, which is nothing but cartilage is hydrophilic tissue with high water content, which leads to this high signal intensity on T2. They can be primary or secondary, primary or de novo. Secondary can be, chondrosarcoma can be arising from pre-existing cartilaginous mass or enchondroma, nothing but osteochondromas. So this was a case of sternal chondrosarcoma. Thank you all.